Hello, my name is Kyong from Dangung University in South Korea. It is an honor to be able to present this at the 79th All India Ophthalmological Society Conference. Used to define dry eye syndrome as follows. Dry eye is a multifactorial disease of the ocular surface characterized by a lack of homeostasis of the tear film that result in symptoms of discomfort, visual disturbance, or ocular surface signs. For the diagnosis of dry eye syndrome, symptoms are surveyed, and homeostasis marker tests such as tear break of time, tear osmolarity, and ocular surface staining are performed. And then the evaporative type or the aqueous deficiency type is classified according to the presence of MGD and the tear meniscus height. Various imaging tests are performed to diagnose and classify dry eye syndrome. Examples include meniscometry such as keratography or OCT, NI-beauty, sonography, mammography, and interferometry test. First, in the diagnosis of aqueous deficiency dry eye, there is an imaging technique for the tear secretion. Tear meniscus height can be measured using keratography or OCT image, as shown in the picture. In this study, using anterior segment swab source OCT, the tear meniscus height was measured and analyzed, and the cutoff value for the diagnosis of dry eye syndrome was presented. Most images are taken 1 second after blink while blinking spontaneously during the examination. In these two, the tear meniscus height value for the diagnosis aqueous deficiency dry eyes is 0.2 mm. Spectrally sourced tear meniscus height measurements were more reliable than the new keratograph data. Agreement between the devices was poor. A tear evaporative test is required for the evaporative dry eye diagnosis. While doctors can visually measure tear break time using fluorescein, specular reflection images can be used to measure non-invasive tear break of time. An eye beauty results in longer measured value of time to break up than stability assessment techniques involving fluorescein installation. A method of measuring the stability of the tear film by projecting a grid pattern composed of radial straight lines and circles onto the cornea using a circular projection device. The time when distortion appears on the projected line was defined as the tear film destruction time. A 46-year-old female patient presented with complaints of ocular discomfort and curing. The tear meniscus height is 0.3 mm and the non-invasive tear break-up time is 3 seconds, so it can be diagnosed with an evaporative type dry eye. The cooling rate of the ocular surface is faster in individuals with dry eye disease than in normal eyes, which is measured to be as a result of a greater rate of tear film evaporation. Next, we will talk about imaging techniques in diagnosing MGD. MGD is an abnormality in the lipid component of test due to anatomical and functional abnormalities of the meibomian gland. This may result in alteration of the tear film, symptom of eye irritation, clinical apparent inflammation and ocular surface disease. Meibomian gland dropout is observed on mammography in MGD patient. The interferometry principle can be used to measure the lipid layer thickness in tears. Can MGD be diagnosed by lipid layer thickness alone? In tears, thickness is important for lipid layer, but lipid characteristics and dynamics are also very important. In addition, care must be taken to avoid contamination of lipids in tears during the examination. In this patient, tear secretion is normal in the Sherman test, but the lipid layer thickness is 43 nanometer in the right eye and 66 nanometer in the left eye. Mammography shows severe dropout of meibomian glands in both eyes. In this patient, tear record time and lipid layer thickness were decreased, but meibomian gland dropout was not severe. When I squeezed the meibomian gland, a toothpaste-like lipid came out. Even if there is no abnormality in the mammography, dry eye can occur due to abnormal lipid, like this. The following is the discrepancy between the lipid layer thickness value and the mammography or the clinical findings. In patients with MGD, if tear secretion is small as shown on the left, the lipid layer thickness may be measured relatively thick because the lipid does not spread well. As shown on the right, if there is a lot of tear secretion and spreads well, the lipid layer thickness can be measured thinly. This patient has a right eye conjunctivitis, so the lipid layer may be thick. However, this is an abnormal lipid layer. This patient has a severely reduced lipid layer in both eyes. If you look here, this patient doesn't close his eyes very well. This makes dry eye. The above test methods can be used to diagnose and classify MGD and determine treatment method. Let's talk about imaging techniques on ocular surface. The part that comes into contact with the cornea is called the lid wiper, and the stained area is called the lid wiper epithelial path. Confocal microscopy can be used to image the corneal lobe and the conjunctival epithelium. Conjunctival injection may also be an important sign in dry eye syndrome. Thank you.